So our second speaker today is Dr. Peter Schubert, joining us from Vancouver. Dr. Schubert is a research associate at the Center for Blood Research and has expertise in blood component biochemistry, proteomics, blood product quality, and pathogen inactivation.
Well, thank you very much, Everett, for the kind introduction and the opportunity to talk today. Okay, perfect. So as outlined already in the covering slide, the topics what I want to cover in these 10 minutes is to just share some brief introduction into platelet function assays, how we determine in vivo and vitro quality. Next, to compare in vitro quality of platelets stored for 5 versus 7 days, which is targeting exactly the topic what we are covering today. And lastly, to understand some clinical data comparing platelet efficacy stored for 5 or 7 days. So before Canada was considering introducing 7-day platelets, there were several countries in Europe already experiencing their introduction of 7-day platelets. So we were able to converse with these countries and see their pros and cons. And then quickly after, like in 2016, FDA opened the first time the door to consider introduction of 7-day platelets. And pretty much a year later, which was published here in these blood notes in an internal CBS flyer, CBS was able to report the implementation of 7-day platelets into Canadian Blood Services blood system. And just recently, out of our group, a professional education letter came out, which was led by Catherine Serrano in our lab and Dana Devine, to just shed a little bit more light on the data which were used to support the 7-day platelets and a little bit more understanding on the interpretation of these data to fulfill some of the questions which were arising in these couple of months since the introduction by our stakeholders. And I want to just summarize some of these data in this presentation. So just to go back and give a brief overview of the quality panel which we are using in CBS to assess the quality of platelets, there are 3 different aspects I want to point out. First of all, our quality control system, which is mainly focusing on 3 parameters, which is the pH, the platelet yield, and the residual white blood cell count in platelet concentrate, which is assessed by every unit which we are producing and which will leave the organization. But on top of this, we have a quality monitoring program, which is run by Craig Jenkins out of Ottawa, and the studies are usually carried out in our lab here by Brana Kulibrick and Elima Levin. They use a little bit extended panel looking beyond platelet concentration and mean platelet volume into other aspects, what is happening in the platelet bag during storage or here at the end of storage, assessing besides pH also glucose and lactate levels, which are part of the ongoing metabolism in platelets during storage, and platelet activation as a means of degranulation and changes in morphology. And on top of this, there's always an ongoing interest in extending that panel and finding new tools to assess platelet function and quality by looking, for example, at platelet response to agonists like ADP, looking at the amount of microvesicles released into the supernatant, which is then also transfused, means of apoptosis and platelet activation and others. And on the other hand, these tools are all stemming from biochemical analysis of things what is happening in the platelet during storage, which we refer to PSL or platelet storage lesion. And just a definition of this term, which is the sum of all heterogeneous changes in the platelet structure and function that arises from the time the blood is withdrawn from a donor to the time the platelets are transfused into the recipient. And just quite a complex cartoon, but just to make it simple, this represents a platelet. The left side is representing a resting platelet, so a more fresh platelet, and the right side a stored platelet. And you see there are a variety of biochemical features ongoing during storage, which is a natural process what platelets undergo in the bloodstream as well. And we're looking, for example, as I was saying, the degranulation of alpha granules, and we can look at platelet release rate. We can look at the microparticle release. We can look at features of protein changes that can be on a signaling level or what's happening in the entire platelet proteome. So there are a lot of tools we can use and we are actually using and to see how helpful they are to assess the quality of a platelet. So on the other hand, besides in vitro, there's also the in vivo aspect, and I just want to introduce quickly how the research world tries to assess these. This is just looking at the platelet count monitored over the post-transfusion time. So usually at a day or a time point 0, they use a stored platelet sample, radio-label that with one isotope, and at the same time, they take a fresh platelet from the same patient who they transfuse it into, label it with a different isotope mixes, and transfuse it back into a patient. And then they monitor over the next 24 hours the platelet count in that patient. And usually after 1 hour, they take the count which resembles the recovery of the transfusion, the transfused platelets, and after 24 hours, it's defined as the survival of these platelets. So these are research aspects, and of course it is not done in clinical trials. In clinical trials, they just monitor the platelet count after transfusion, which they refer to as corrected count increments after 1 or 2 hours versus 24 hours, and we will get to that when I discuss one of the papers, which is crucial for the 7-day platelet. So the heart of the data which were helping CBS to convince Health Canada to move from a 5-day to a 7-day platelet is summarized in that slide here. So the top one is data collected from pooled Buffy coat platelets, and the lower table is from apheresis platelets, but the effect is the same. So I will not separate these data, but I want to highlight the aspects what were crucial to understand what is happening, comparing stored data at day 5, which is the left column, and day 7, the right column, and p-values as the statistical significance between these data. So the first aspect, what we can see from these data is that except for the platelet count, all other parameters which we are measuring here, which included pH, glucose, and lactate as a metabolic measure, for example, showed significant difference between day 5 and 7. But this difference is mainly due to the fact that these values trend into the same direction between 5 and 7, because as I was pointing out before, there's an ongoing, these platelets are still alive, and there's an ongoing metabolic activity in these platelets. And of course, they will use up more glucose and produce more lactate as part of their metabolic activity. But within the standard deviations of these results, these parameters are fairly close. It's just from the statistical point, they are different. So that's shown here. And these data also show, as I was saying, the continuation of the platelet storage lesion in the back as a mean of glucose consumption and lactate production. So, but on top of this, it is very crucial if you look at the pH. It is important to point out that especially on day 7, which was the new extended expiry time, these pH, although they are significantly different to day 5, they are still far off the cutoff what we have at CBS, the pH of 6.4, because the pH here you can see is 7.2 plus minus and 7.1 for the apheresis units, which is far off 6.4. And lastly, platelet activation, which I was introducing before, we measure at degranulation, is significant different, but still is a mean of the biochemical reactions or mechanisms ongoing in the back. So from a clinical perspective, there are a variety of clinical studies out in the literature, but the majority don't really address the difference between the quality of day 5 or day 7. They are mainly focusing either on just looking at the feasibility, what the quality, in vivo quality of a day 7 platelet would be, and that's not helpful to compare 7 versus 5 because they only focus on day 7 platelets, or they are looking at differences between different produced products, and as a side product of these studies, they looked at different time frames, but never really focusing on the fresh before 5 and after, except one study which I want to introduce here, which came out of the UK, and they really looked at platelet in vivo quality, looking at patients receiving platelet units between day 5 and 7 versus stored for 6 to 7 days. So this was a non-inferiority crossover trial comparing, as I was saying, platelets either 6 or 7 days stored or 2 to 5 days. And the cohort were stable hematology patients which received either or in random order. And the primary outcome was, as I was mentioning before, corrected count increment post-transfusion. So the results was that platelets stored for 6 or 7 days were non-inferior versus the platelets, the patients which received day 2 or 5 day platelet, and in terms of the corrected count increment. And there are the numbers, they come up in a second on the table. And as a secondary outcome, they were also looking at the bleeding scores, which had no significant difference. And I think that is the main outcome or the main message of that paper, showing that there's no significant difference in the patients transfused with platelets stored between 6 and 7 days versus platelets stored between 2 and 5. And that was actually the main study used to support the submission to extend the shelf life from 5 to 7 days. So the main message in that paper was that there was no evidence that a 6 or 7 day platelet was inferior over a 2 to 5 day stored platelet. So in conclusion, the in vitro data, what we had collected and which were submitted to Health Canada, showed a continuation of the platelet storage lesion, but at least from the QC point of view, the PA was still in spec and fulfilled the QC requirements. From an in vivo clinical perspective, as I was just showing, the study showed that there is no difference if you receive a 6 or 7 day plate storage stored platelets versus a 2 to 5. So that supported that move as well. And as a positive effect of that move, that helped CBS to improve the inventory management. It helped to reduce, of course, the wastage because we can store them longer or can use them longer. And of course, it has a positive impact on the cost reduction. So in conclusion, as Sandra was alluding, there are a lot of people who were involved, and they deserve a big thank you for helping to implement this move fairly quickly within a year, at least from the time frame what we know, and all the people involved in making that happen. And thank you for joining that Knowledge Infusion event.